cases in Nairobi last week. What is that? Just campaigns.
But you also have been on the spotlight talking about Matiang'i. Is that not equivalent to campaigning?
Remember,
okay.
I am in the opposition.
Okay. So you're allowed?
I am in the opposition.
Okay.
So I can play my opposition
your politics all
by
through.
Pointing out the difficulties. You who is in government should be seated in offices and sorting out the issues that we shoot them. But not on top of cars, driving and making the country, get the country frenzy with politics. Today, I'm told 7 days of campaigning in Mount Kenya. Nothing else. And if you are the one who is leading the country and you are telling us to start campaigning and it is you we want to remove, you just are inviting the whole country into a political mood.
But just how different is it with the Jubilee prior to the 2022 general election?
It was very different. The leader
you want to tell me that you people were not out there campaigning?
The leader of the Jubilee Party remained in office. He was
and you
marined,
people were the ones, okay.
He was insulted. He was told that the handshake with the Muchawi has made him crazy. You remember all those things?
Okay.
They were all said when he was in office.
But the campaign process started way earlier. And actually Kenyans were complaining about that.
By the same UDA team that is already campaigning.
That was part of the Jubilee team?
Yes. Okay. So that wing, and we're happy that it migrated.
Okay.
It is a very different group of people.
Okay.
When they were going around the country, Uhuru Kenyatta, our party leader, and Matiang'i, that time because Matiang'i was left in office assisting Uhuru, taking over really the duties of the deputy president, who did not even know which direction his office desk was facing. He never got to sit in that office. They were the ones who sat and came up with universal health care. And it was tried in Nyeri, Kisumu. You'll help me with the counties because you also know the towns.
The counties in this country.
Kisumu, Machakos, and Isiolo.
Yes.
Those were the pilot
of the universal health coverage.
And it worked.
Yes, it did.
They were going to roll it over to the other counties. What did the KK people do? They came and reversed it, and we went to this Shi-Sha thing that everybody is screaming about.
Okay.
Remember, talk about it. There was even the issue of Rida Mama, where it was now going to be a government position that no lady, no woman would want to deliver, would deliver somewhere which is not properly provided for along the roads or even in dispensaries that are not well done.
Okay.
That worked. Today, done. We had something called the Duafia, where every child in this country school going was provided with insurance cover. All that you needed to do as a teacher, whenever a child got unwell, was take her to hospital and the government would foot the bill. Remember, it is during those days when others were campaigning and Matiang'i and Uhuru were in office, where we got 100% transition in our education. Today, you know, by the way, do you know, and there's no law that has been changed.
And I want us to take a break.
Before, let me say this. There's no way I can, I will not say this. The chiefs and the assistant chiefs were dreading the outcome of results. Why? Because it was their responsibility to ensure that every child
gets to school.
Goes to school. Today, we have 175,000 kids who dropped out of the secondary school.
We still have a fair share of flaws that clouded the Jubilee Party and the Jubilee government.
But we are not in power now.
Why do you suppose, why do you suppose that Kenyans will be convinced to have you back in power after this short break?
Well, they are going to make a choice. I'm not saying that. That's why I'm teaching for it.
Okay, after this break.